My name's Kirk Behrendt. I'm the CEO of ACT Dental Practice Coaching, and we coach dentists all over the world. And one of the things we encourage dental practices to do is really identify the customer journey or patient journey into the practice. Now, here's why. Because you as a dentist might understand how you would like patients to come into the practice, but oftentimes team members aren't communicated clearly about how to do this. And so however you do it, make sure that it's mapped out and it's really clear that patients come in. The other thing to remember is this. It's very costly to acquire a new patient. So the dogmatic approach of having them only come in one way is often a challenge now more than ever in practicing dentistry. You want to make sure that you are easy to do business with. It doesn't mean you give patients everything, but as a team, be extra committed to service and clarity around expectations where and how patients come in. Now, one of the things I show teams all over the world is this. You decide how many circles you want. You might want to create a diagram that has 4 circles. I like the idea of patients coming in one of 4 ways. So that if I'm a team member and I'm talking to somebody on the phone and they have particular questions and maybe they're a good patient for us or maybe they're not, I've got some flexibility in how we can bring them into practice. And we all hang our hats on one thought. If we can get them here, they're gonna stay. So keep that in mind as you design this process. The first way a patient might come into your practice is what's called a records appointment. Some of you might call it a comprehensive exam or a records appointment, but it's a specific amount of time, at least more than an hour, sometimes 2 hours, to gather information about the patient and learn who they are and their conditions before deciding where to go next. Now, the key piece to this is that is not about data. It's about connecting with a patient. And we're starving for significant relationships in this world, and what a great opportunity that we have that protocol in place before we go and do restorative dentistry or any other type of dentistry. We know who they are. So that is often the most preferable way they come through the practice. The second way patients can come through your practice is what we call a meet and greet. Now, this is where you have to get creative as a team. It's often, for most practices across the country, 30 minutes, no charge, a meet and greet in which you bring a patient in and you can do several of them in a day. You often align them into what's called a phantom column, which I'll show you in a second, but you can have 3 to 4 patients a day come in 30 minutes, no charge. Oftentimes you'll block an hour and you'll have them come in, you'll give them a tour, maybe take a few photos, and maybe introduce them to the doctor or maybe not. There's nothing clinical that's really done in that particular appointment. It's an easy way for the patient to meet you and for you to meet the patient and for you as a team to decide, is this somebody we want to invest more time in? The key in every dental practice is you want to be making sure that you're giving your best energy to the things that matter most, and this becomes a great filtering system because you know there are going to be some patients that come in, they might not be the best fit. And then there are others that just appreciate the fact that you gave them an easy way to meet you, and now you can build value for what we discussed earlier, which is the records appointment. Now, some of you as dentists might be watching this thinking, I could never do 3 or 4 of them. That's right, you would never do them. You have a team member that's designated to do this that has the gift of hospitality. So keep that in mind as you design this process. The third way that patients might come into the practice is through hygiene. Keep in mind that 17 to 18 to 20% of your patient base is going to disappear every year. They get displaced, they die, and when you get new people that come into the community, sometimes that's all they know is getting their teeth cleaned. So when somebody calls your office and says, hey, can you clean my teeth? It doesn't mean they're a bad patient. Doesn't mean they're not the right fit for you. It's just all they know. We would obviously create value for a records appointment if we feel like they're a good fit. If that doesn't work, we might talk about a meet and greet, but if they say, hey, look, I just want my teeth cleaned, it gives us a great opportunity to schedule the appointment and grow the practice that way. Now, one thing that's very important about that appointment, you can't promise that you're going to clean their teeth. You might want to say something like this on the phone. If we can, we will. But I'm going to set you up with Sarah. She's one of our expert hygienists. And here's how the appointment works. During that appointment, Sarah, your expert hygienist, will build value for the rest of the customer journey or patient journey that lends itself to the best fit for you and the patient long term. The fourth way a patient might come into the office is through what we call an emergency. And years ago, I've been doing this for more than 20 years, and I'll tell you, I thought years ago emergencies were a bad way to build a practice, but that is absolutely not true anymore. The data shows conclusively that emergencies are a great way to build a practice now more than ever. And so when people call your office, this is how you describe it. They might have a broken tooth. They might be in pain. The key here is you don't want to promise definitive treatment, oftentimes to people that you don't know. Because if you do that, you're probably going to create a situation where they have a balance and they don't come back, and you're going to stack them on your favorite patients. So what I'm going to encourage you to do today is this. Change the word of that. Don't ever use the word emergency as long as you live, because the truth of it is, there aren't really any dental emergencies. And you could even have a little fun with this in your office. When a patient says, oh, they've been in pain, you ask them, how long has the tooth been broken? They go, well, it's been broken for about a year. You know what I mean? So what constitutes an emergency, you have to decide as an office, but there are really, truly very few dental emergencies other than trauma. And what I'm going to encourage you to do is change the word of that particular appointment from emergency to comfort appointment. When people call and they're in pain, you want to recognize that, empathize that, and say, Mrs. Jones, sounds like you're in a lot of pain. Let's do this. I'm going to schedule a short appointment with the doctor. Now, the doctor's not going to fix the problem, but the doctor's going to get you comfortable. That way, you're lowering the expectations. You can find out why this is happening, and you know how this works. When somebody comes in with broken cusp, it's not just an isolated problem. It's usually the tip of the iceberg where there's a lot more going on, and you as a clinician and you as a team can build value and say, Mrs. Jones, there's a lot going on here. I'm going to get you out of pain for now, but the pain's going to come back, and here's what I'm going to recommend. I'm going to recommend that you come back for a records appointment. A records appointment is a much longer appointment. It's about 60 minutes or 90 minutes where we can find out why this is happening, and you and I can develop a plan together, and you can make all the choices. You see how you're building value for another component of the patient's journey, and you can see how the whole team gets on the same page. You as a dentist might be watching this go, Kirk, this makes perfect sense. But the truth of it is most team members don't know how this works. And what a great opportunity this is when everybody on your team has a heart of service and they know exactly how patients are brought through the practice and they know how they can triage them to the next step that's in the best interest for everybody involved. Now, you might add other steps. One of the other steps that you might add is a consult, which I'm going to highly recommend. You're going to gather information, make a connection with a patient in a records appointment, but most of you doing something significant restoratively or even in specialty dentistry, you're going to have the patient back for a consult. And that just gives you enough time to review the information, gather yourself, and present knowledgeably what might be some of the best options for the patient. You decide the interval on how that works best for your practice. Then another component you might want to add, which we see a lot, is a pre-op appointment. Now let me explain what that is. A pre-op appointment is just one additional appointment somewhere in the process where we're just going to get on the same page with expectations. Let me give you an example. Let's say a patient comes through an emergency, which we now call a comfort appointment. Then they go to a records appointment. We have a great connection with the patient. They come back for a consult, and now they want to do significant restorative dentistry, and I've got the patient scheduled for 6 hours with the doctor. I'm definitely going to have the pre-op appointment for one thing. Make sure we're all on the same page, because you're not getting the 6 hours with our doctor unless we know you're going to show up, we know you're going to pay, and all expectations are clear, and you got to have somebody that's a great listener in that whole process. So that becomes a very valuable tool in excellent dental practices now more than ever across the country. One other thing that comes up quite consistently is that when we're discussing discretionary dentistry in which patients have to make an informed decision, often with dollars or time, they are going to want to think about it. And it's very important to understand the buying process of patients. They might be thinking, man, you are expensive. Maybe I could go and get a second opinion. The key here is you've got some place where those come. You're going to get second opinions in your office, and you're also going to get people leaving for second opinions. We're going to keep that phantom column available for those people. Another piece of research that's really important is that people often go with the last person they speak to. So be sure to be intentional about that. If patients want to go to get a second opinion, don't discourage them, but say to them, Mrs. Jones, I totally respect that you want to do that. Let's do this. Let's schedule one last appointment before you decide to do that dentistry, and we're okay if you go somewhere else. We just want to make sure you're in great hands because we care about all of our patients. And again, the reason I'm showing you this whole process, it doesn't have to be complex. It can be quite simple, but everybody on your team now knows how we communicate with patients and we help them along their dental journey within our practice. This used to be really easy for you when you had 4 team members, but now you have 8 team members, or maybe you have 16 team members. The complexity doesn't double, it quadruples every time you reach one of those landmarks. And your job as an entrepreneur is to consistently make it simple. Now I'm going to leave you with one last thought because we mentioned the use of the phantom column. The phantom column is one of the greatest gifts to practices all over the world. It's an additional column that you probably don't even have chairs for, and you don't even have ops for. So you've got your side of the practice for the doctor, which is your columns. Then you also have hygiene columns. Well, then there's an extra column over here that you can create called the phantom column. Now, the phantom column is very important because that's where we're going to put all of these meet and greets, these second opinions, and important touch points within the schedule. Here's why. Your eyes are on that schedule about 80% of the day. I often joke that you look back from looking at the schedule at the patient, and the schedule's burned on your retinas over the patient's face. What gets put in the schedule actually gets done. It's not a sticky note, it's not an email, and you as a team together can check these things off. If the doctor has to meet with a patient for a second opinion, or the person that's responsible for that column is going to have a bunch of meet and greets, this is where they go, and everybody's on board about where they go. Again, the big piece is understanding the patient's journey in your practice and making sure everybody's on the same page. Because when you don't have any clarity, it usually ends up being very confusing and you have conflict later on. Now is the time to take an ordinary concept and make it extraordinary in your practice, in which people say, you guys really know what you're doing, with a great patient journey.